Hello, good afternoon, everyone. On behalf of Dentium, I warmly welcome you all in today's webinar on Above or Below the Bone, the Ultimate Implant Level Showdown. This webinar will be informative and beneficial for those who are planning to start implant practices. We are privileged to have Dr. Avantika Tripathi, MDS Oral and Maxillofacial Surgery and Dentium KOL as our esteemed speaker, bringing expert technical knowledge and practical insights on the use of Dentium bright implants. We encourage all the participants to kindly stay until the end of the session to avail webinar special packages and a chance to win one bright fixture in the lucky draw. Thank you for joining us. Now over to Dr. Avantika.
Very good evening to all of you. Welcome to today's webinar. So today's topic is regarding the bright implants, bone level and tissue level variants. And as we all know that dental implantology is evolving daily. And since last few decades, it has evolved a lot. And today we have multiple implant design, surface technologies and restorative options to choose. So, but still, we always have one question in our mind that which influences our treatment planning and long-term outcomes, which is that should I place my implant above the bone or below the bone? So in today's webinar, we will compare the two proven treatment concepts, which is bright tissue level and bright bone level implants. So this webinar is to make you understand and select the right implant design based on the clinical indications. So according to your case, you can choose which implant is best for the patient. Again, the question is not which design is better, whether the bone level is better or the tissue level is better. But the question is which is better for your clinical condition. So before that, we need to understand what is this bone level and tissue level basic sole concept. So the bone level implant to abutment junction is located slightly below the crestal bone or at the crestal bone. That depends on us whether we want to place it subcrestal, equicrestal. In tissue level implants, there is always a healing abutment sort of a structure attached with the fixture. So it is mandatory that in tissue level implants, the implant abutment junction is always positioned above the crestal bone. In the bone level variant, implant is fully submerged within the bone, whereas in the tissue level, it is visible through the soft tissue. In the prosthetic emergence profile is developed through the prosthesis. We have multiple prosthetic options by which we can choose and we can create the emergence profile according to our requirement. In the tissue level implants, as it is made very, very simple and easy to use, it has a standard restorative platform which always remains within the soft tissue and the abutment will be seated over it. Now, what is the main requirement of choosing the implant levels? Why the implant level matters a lot. So basically, the implant abutment junction is one of the most biologically critical areas in implant dentistry. And the position of this implant abutment junction, influences the crestal bone preservation, which later on prevents the marginal bone loss. Soft tissue stability, how better your soft tissue will be able to hold around your fixture. Bacterial colonization, if the patient is more prone to, or the patient is not maintaining good oral hygiene, then obviously we'll choose that type of implant which requires low maintenance. Prosthetic flexibility, suppose in immediate implant cases, I need a fixture to be placed which allow me to be more prosthetic flexible. In anterior implant cases, I need an implant system which allows me to provide good amount of aesthetics. Ease of maintenance, it should be very, very simple and easy to clean and maintain. And long-term aesthetics, it should be able to provide and to keep that aesthetics for a long time. So if we talk about the bone level and tissue level implants, the drilling protocol for both bone level as well as tissue level is same. We do not have to prepare or do anything different for the placement of tissue level or bone level. The drilling kit as well as the drilling sequence will remain the same. When it comes to the placement of implant, then the placement of implant is also the drilling speed, torque, everything is same only, but the main difference is in the drivers. So the drivers used for bone level and for the tissue level implants are different, as the connections of both the implants is different. Understanding the tissue level implants first. So the tissue level implants have a healing abutment sort of a structure attached to it. These are solid implants, so that is why they are available in thin diameter starting from 2, 2.5, 3, 3.5, which is mainly indicated to be placed in thin bone areas, mainly in the mandibular or maxillary anterior areas, where we do not have to do excessive bone grafting, and instead of doing those extensive bone grafting, I can simply place a thin diameter implant in those areas. And it is also based on the bone preservation concept or minimalistic concept, in which I can place a 3.5 diameter implant in the molar area instead of placing a 4.5 or 5 diameter implant, and I can preserve that 1 or 2 mm of buccal or lingual bone from the surrounding area to provide more strength to the fixture. So this is mainly based on the minimalistic concept. It has a dome-shaped body, which again is very good for the preservation of marginal bone. So the center portion, the middle portion of the fixture is the widest, which is going to provide more bone to implant contact. In the cancellous bone, as we know, in the center there is more of cancellous bone, so the widest portion stays in the cancellous bone, whereas it has a narrow neck and a narrow tip. So the narrow neck is going to provide it is going to it is going to prevent marginal bone loss, it is going to preserve the crestal bone, whereas the tip is also little pointed, which is going to pierce through the bone, and it is going to provide good amount of primary stability. It has an external hexagonal connection, so it has a 20-degree external taper. So when the abutment is going to be seated over it, it is going to make an angle of 20 degree with the fixture. It has a concave neck, which is very good and very important for a soft tissue contour. So it is going to nicely contour the gum around it. As I told you that it is available in thin diameter starting from 2 till 5 mm, which has a standard platform of 3.8. So whatever the external diameter of the fixture is, the platform diameter always remains the same, which is 3.8, which is made to simplify the prosthetic components. Because if there will be multiple platforms, there will be a huge amount of prosthetic options. So just to simplify the prosthetic workflow, it is made standard. Making you understand the procedure with the cases. So this is a case of a ailing 2-2. In this, I did immediate extraction followed by immediate implant placement without doing any bone grafting. So the bone grafting was not required because I placed a very thin diameter implant, and I preserved that much amount of buccal bone, and I placed an immediate implant after removing the tooth atraumatically. So the tooth was extracted by not giving any type of movement. It was a simple, pure atraumatic extraction. Once the extraction was done, the drilling was done with the Lindemann 2.5. X-ray was taken to confirm the position. Then a 3 mm drill was introduced And then because I placed a 3 mm implant in this, so after that, immediately the implant was placed and the X-ray was taken. So after that, the patient's jig was in and the prosthesis was delivered to the patient. So this was the immediate implant placement with immediate loading. So we can, in the anterior cases, it is a boon, as in the immediate implant cases, patient can go on the same day with the final crown. This is another case with the missing 1-1. Here also the bone was very, very less. And I was planning to do, earlier I was planning to do extensive bone grafting surgery, but then I planned to place a bright tissue level implant of thin diameter. So in that case, I did a very, very less minimum amount of bone grafting and along with that, I placed my thin diameter implant. So as you can see, the bone is very thin. So I drilled with a single drill of 2.5 mm, and after that I placed a 2.5 mm implant. After the complete placement of implant, I saw that the buccal cortical plate had a crack on the labial surface. So I planned minimum bone grafting just to bulk up the labial cortical plate. So I extracted some autogenous bone from the ramus area. Along with that, I packed it with the xenograft, and then I stabilized it with the membrane pins, and then I sutured it back. So instead of doing a very, very extensive surgery of putting a cortical plate, extracting a cortical plate from the symphysis region, placing it, stabilizing it with the screws, and then increasing the buccolingual width of the maxillary anterior region. Instead of doing that extensive surgery, I placed a very, very thin diameter implant, packed it or bulked it up with very minimum amount of bone, and then I completed my surgery and I loaded it also within 2.5 months. So this is the final crown of the patient. In the case 3 is of a patient, a young lady, which has two ailing teeth, 3-1 and 4-1, which were indicated for extraction. So I removed them and I curated the area nicely. I cleaned the area, I removed all the granulation tissue, and I immediately placed two thin diameter tissue level implants in there. So the main purpose of showing these cases is to make you understand that these thin diameter implants, tissue level implants, are making the making the surgical workflow very, very simple and easy. Those who do not want to do extensive bone grafting procedures can simplify the surgical procedure by placing a thinner diameter implant. In some cases, bone grafting will not be required, whereas if it is required also, it will be very, very less. So what are the ideal indications for tissue level implants? It is mainly the posterior maxilla, posterior mandible, or thin ridge cases like I showed. In the elderly patients also, like I placed an implant in the 85-year-old patient, I placed an implant in the 4-6 region, that because of the simplicity of the prosthetic workflow and easy to maintain. Patient can brush, patient can maintain the hygiene also very, very easily. Coming to the bright bone level implants, bright bone level implant have a deep connection. So the abutment is seated at a depth of 3.7 mm. So it has it doesn't have an external hexagonal connection, it has an internal hexagonal connection. So in this, like in tissue level, the abutment was sitting over the fixture. In this, the abutment will be sitting under the fixture. It is hollow from inside. So that is why it is not available in very, very thin diameters. The diameter is starting from 3.5 till 6 mm. it has a deep connection of 3.7, which is very, very good, which is going to provide excellent joint stability, which means that the abutment is going to seat under the fixture at the depth of 3.7 mm, which is going to provide good stability to this connection, which later on will not lead to screw loosening or abutment loosening. The diameters, as I already mentioned, are available from 3.5 till 6 mm. It also has a aggressive thread design, and which is going to provide excellent primary stability in immediate implant cases. Just to simplify the prosthetic workflow, as in bone tissue level, we have a standard platform of 3.8. Here we have an internal diameter of 3.3. Irrespective of the external diameter of the implant, the internal diameter remains the same, that is 3.3. So whatever abutment you want to seat on any diameter implant, you can. So this is mainly based, as you can see, that the bone diameter is 8.7 in these cases, but the implant diameter, if ideally I would have chosen an implant diameter of 6 mm in this case, but here I placed an implant of 4.5 diameter only, just to preserve the buccolingual bone. So as you can see, the bone is very, very good, but still I placed an implant of 4.5 to just to preserve the buccal and lingual bone. It is not necessary in bone level or tissue level bright implants to place the implant fitted with the diameter of the bone. We can place a thinner diameter implant and we can preserve that much amount of buccal and lingual, cortical and cancellous bone to provide more stability and more long-term success to the implant. So this concept is called as minimalistic concept, and this is mainly the bone preservation concept. So I placed 2 bone level implants in this case. This is the 3 months OPG of the patient, and this is the final prosthesis. This is the case of a patient with root stumps present in the 4-6 and 4-7 region. I removed the root stumps and placed 2 bright bone level implants immediately. As I told you that it has a very good primary stability, so in immediate implant cases it works wonders. It is going to provide a very good primary stability in minimum bone as well. So because of the aggressive thread design and long cutting edges of the bright bone level implants, we can place it in the immediate implant cases, and we can load it within 6 to 8 weeks. So these are the x-rays of the same patient in which I placed 2 bright bone level implants of 4.5 by 9 mm. So over this I placed 2 healing abutments of wide diameter just to cover the occlusal surface, and I sutured it back. So what are the ideal indications for bright bone level implants? Immediate implant placement, as I mentioned, that they are going to provide good amount of primary stability, excellent primary stability. So if you want to immediately place an implant or immediately load a crown over it, then it is better to go for a bone level implant, as the tissue level implant is not going to give you that much of prosthetic versatility as a bone level implant. You will not have an option of choosing the different type of gingival height, as the bone tissue level implants have a standard gingival height of 1.5. In the high aesthetic demand patients, like in the anterior region where the bone diameter is allowing you to place a bone level implant, you should place a bone level, because again the gingival height can be altered in the bone level, whereas it cannot be managed in the tissue level implants. If there is less amount of interocclusal space, then we should go ahead with the bone level implants, as the tissue level implants is already attached with a healing abutment sort of a structure. So we should always make sure that that is not coming in contact with the opposing tooth. So there should be a certain good amount of interocclusal space available between the 2 teeth. between the fixture and the opposing tooth. So, as I mentioned, that bone level and tissue level implants have different type of connections. One has the internal hexagonal connection and the other has a external hexagonal connection. Their purpose, they looks almost the same, but their structure is quite different in terms of the connection. The thread design is almost same. The tissue level implants are more of dome shaped, whereas the bone level implants are more aggressive in design with the long cutting edges. The tissue level implants are solid, whereas the bone level implants are hollow from inside. Mainly tissue level implant wins when you want your prosthetic workflow to be very, very simple and easy to do. So if you want to place an implant, put a prosthesis over it, so you do not have to, as we all know, that it has a healing abutment or type of structure attached already with it. So you do not have to do a second stage surgery. So implant placement, and after that, immediately you can start the prosthetic workflow. You do not have to cut open the gum again, as the abutment and fixture connection is above the bone level, so hygiene maintenance is easy. Posterior rehabilitation is easy with them because their aesthetics is not a major concern. Bone level implant wins when aesthetics are critical, when aesthetics is your major concern. When you want a customized prosthetics, mainly in the anterior region, then you should go with the bone levels. Immediate implant cases, you should choose the bone level. Mainly, again, it is case dependent, but mainly you should choose the bone level as compared to the tissue levels. So, at last, I would like to conclude that you should place your implant above the bone for simplicity and maintenance, and you should place it at the bone or below the bone for the aesthetics and prosthetic freedom. So, the debate is not about determining a winner, that which will win, bone level will win or tissue level will win. The debate is about choosing the best or the right implant for your correct clinical condition. So, if you are able to choose it wisely, understand it wisely, then you will be able to get good results with both. So, thank you so much for attending today's webinar. If you have any query, you can ask.